Hi patients, here from McKenna Landing, Dr. Kara Olson. I would like to talk to you a little bit about my frustrations as a doctor to the patients out there. Now, most of you haven't met me before, maybe some of you have, but being a doctor isn't all glitter and gumdrops and cherries. There's a lot of arguing that can occur between a doctor and a patient because of miscommunication. And I truly believe that the patient is responsible for the body. So you have your own body. I'm responsible for this one. You guys are responsible for yours. When you come in, we have paperwork that we need you to fill out that really gives us, that's the information we're going to need to assess what's going on so we can give you a great answer to what you're looking for, because we know that patients are coming in and you guys are going to ask us questions and we want to be prepared. We really want to help you. Here's the number one thing that I see patients going to the wrong offices for the wrong things. I had a patient the other day who said, my sister's forcing me to come here, I just want to get my surgery on Monday and I'm really nervous, and I could see it, you know. She was yeah. Her body language, and it was awkward, and I said, that's okay, you don't have to be here, just go have your surgery. Surgery's great. It sounds like you found a good doctor and you've got a therapy. That's awesome. So I want you, the patient, to take your health seriously and take responsibility for what's going on with you. I have a book coming out soon to kind of help guide you on how to take care of your own body and be your general practitioner kind of on your own, and then go see a doctor sooner because you're paying attention to yourself and you'll know. Little leaks are easy to clean up. Big leaks that have been there a while are a mess. You guys know that. Let me give you another scenario of a patient who came in the other day. Said, I went to my doctor. I'm super mad at them. They gave me all these painkillers. I don't want painkillers. And I said, then why did you go to your general practitioner? Because that's what they have. They can refer you to a doctor that will either do surgery, they can refer you to PT if you're going to do exercises, or they can give you something for the pain or a muscle relaxer, okay? And they were really frustrated they did this, but you know as the patient that that's what they're going to do, and that's their tool. So if you like adjustments and you want corrective body movements and we can do alignments for you, go to a chiropractor. If you're going to do exercises, go to a rehabilitative chiropractor like my office. We do extremities, we do nutrition. I have 5 doctors there. We do laser, we do orthotics, right? It's amazing. We have all the specialties covered. Now make sure that you get to see the doctor that can provide what you're looking for. If you only want to do exercises and you don't like adjusting, well, then why are you going to a chiropractor and complaining that you're getting adjustments? If you pulled a muscle and it's there longer than 3 days, like it's persisting, then you have a biomechanical problem. You're walking funny, you're sitting funny, you're doing something wrong. Getting a massage will help the symptoms, but you need to change what's going on, so you need to see a biomechanical specialist, which is either a physiotherapist or a chiropractor specializing in extremities, like our office and ourselves. So make sure before you go seek out a bunch of medical care that you're laying out your path, okay? That what is it that you're going to do? I see a lot of patients that come into me, I adjust them, and they go, I'm just so frustrated, it's there again. And I'll tell them, well, did you do your exercises? They'll say, no, I didn't have any time. And they go, okay, well then we'll just set up corrective more often and just know that over time it gets worse. And then let me know when you're going to be doing the exercises, and then we'll switch to a new plan because you won't have to see me as much, right? And then I'll have to give you some homework, and then we'll get you online in our rehab section where we provide some of that stuff. So just a heads up from me to you. I've probably never met you before, but I really wanted to get people thinking about the path in medicine, because you really are coordinating your own care. There isn't somebody out there that can tell you need to go at this doctor at this time in this order. Let me give you an example. Let's say you sprained your ankle. Number one thing you do immediately is go get it aligned from an extremity specialist chiropractor. We adjust the joint, get the joints perfect because you've moved the joint during the sprain, and it will heal crooked. It will just take a really long time and be sore, and no matter how many massages and no matter how many exercises you do, you're going to exercise crooked. So you're gonna rip where the ligament sprained, you're still gonna have the jam joint, and you're gonna go exercise like this, okay? If you get adjusted, we can support the sprained tissue, open up where it's locked up, and then you can go exercise normal. That is ideal, okay? So if you get adjusted, get the correct alignment, get yourself braced in the joint that moves too much, and get the rehab, which is what we do with our 3 providers at our office, awesome. Some doctors only do one of those, so some chiropractors only do the adjustment, and then the PT does the PT, and then the massage therapist can go in and do the ligaments. That's great too, as long as it happens in that order. If you were gonna go build a house, right? Let's say your kitchen's injured and you need new cabinets. You gotta tear out the old, put in the new. You can't build the walls and then put the electricity in there. You gotta be doing that before you finish, right? You gotta get the electricity in there and frame it out, and then put up the drywall, and then you skim it and sand it, and you wouldn't put the electricity in there after you paint, right? So a lot of people will go and do PT first, exercise crooked, be upset that it doesn't work, because trust me, PT works, and then get a bunch of massage and never end up at the chiropractor. Or some people are upset they went to the doctor and got pain meds, or some are upset that they went to the chiropractor and the pain's still there. Come on, guys. It's your body, you can do this. Go to the doctor that's gonna give you what you want and what you're gonna do. Now, if you wanna be perfect and do no exercises, take no pills, and get no adjustments, you've got an expectation problem. I'm not sure which doctor you see for that. You're just gonna have to learn how your body works and give it what it needs. Okay, so hopefully that helps. Get to the right office, the right doctor. We do our best to provide everything you need there. So by accident, when you come into us, you're gonna have what you need. And go get healthy. Aloha.